The death of someone from COVID-19 doesn't mean they can't still spread the disease. That's the warning of a forensic scientist from the University of Cape Town. Dr. Marise Heyns says those who come into contact with the body of a deceased, like family members, priests and undertakers, are at risk of infection. Dr. Heyns joins us now to tell us more. Dr. Heyns, thanks a lot for joining us this evening. Please, won't you explain the findings that those that have died from COVID-19 may still spread the virus? How so?
It's mostly through contact. While they were still alive, they were coughing and sneezing, and the droplets are now present on the surrounding surfaces. And then the people who have to go and collect these deceased come in contact with the surfaces. There may also be a little bit of aerosol-generated droplets still from the deceased when they manipulate and move the body, but mostly it's through the contact of the surrounding surfaces when they go into the wards or into the homes to collect the deceased.
But if you look at provinces such as the Eastern Cape, for example, where attendance of funerals have been a major catalyst to the spread of the virus in itself, the question is then, are we adequately informed about the burial or funeral process of a COVID-19 positive individual?
No, I think the public out there is not really aware what's going on, but at least what I can say is after the deceased have been packaged and bagged according to the regulations and placed in the coffin, and the coffin has been decontaminated, there is absolutely no way that a person attending a funeral can contract the virus from the coffin or the deceased in the coffin. It's largely to do with the crowd of people that's attending the funeral. That's where the danger lies during the time of attending the funeral.
And if a family member, for example, Dr. Heyns, succumbs to the virus, what is the immediate process to be followed? I mean, I'm just thinking here from a ritual perspective, right? There's certain African rituals or even Western rituals that require family members to wash the body or family members to dress the body in itself. This is business unusual for a COVID-19 positive individual. So then how then do we start informing family members around that process?
Yes, at the moment I've been training the undertakers in the Western Cape on what is allowed and what is not allowed, and how they can protect themselves when handling the COVID-19 deceased. So in the same way, the undertaker will now be the guardian and will have to explain that to the family member when they do view, wash and dress the body as part of the cultural ritual. The undertaker is the one in control during that and on their premises, and they are the ones who need to supply the protective equipment and gloves to the family, and then make sure that the family is acting in the best interest and do not contract the virus through inadvertently coming in contact with the droplets.
And how is the training? When you speak about training in the Western Cape, with the 9 provinces that you and I know for a fact that are more susceptible as well to the virus, how is it that you're training certain organizations around the country to enable them to actually exercise best practice when it comes to even preparing the body for burial?
I've got no idea what's happening in the other provinces. Here in the Western Cape Department of Health and specifically Forensic Pathology Services were proactive and realized they need to get to reach the undertakers and train them, as this is something that none of them have been trained in. The training has gone very well. We've been overwhelmed with people wanting to get the training and wanting to know more, and not just undertakers but also cemetery staff, largely because of ignorance. And I do think the message is not getting out there, it's not communicated, and a lot of people don't know how to get the information. Yeah. So at the moment, training interventions like this have gone a far way of getting the right information out to the people.
And as a result, I mean, you're dealing with the Western Cape, and we're thinking here as well, with the Western Cape, there's the Eastern Cape, as well as other provinces that equally need this information, equally need this training, particularly when it comes to the process of burial. As we've seen time and time again, this issue around the process, the preparation of the body, right up until the burial, has literally been a reason why many of the individuals that we have today are COVID-19 positive.
Absolutely, and it's through ignorance, not knowing where the danger lies, and then it is not adhering to the simple things of social distancing. We know that at the time of a funeral, it's traumatic. People are overwhelmed with emotion. They need to support each other physically. hugging and supporting each other. And that is the way that these droplets will transfer from one person to another, so in a live person. So yes, it is a fundamental adherence to the rules of the day, which is, as you say, unusual circumstances. So we do need to wear the masks and we do need to keep our social distancing.
Dr. Marise Heyns, a forensic scientist from the University of Cape Town there. Thanks a lot for joining us this evening, discussing the matters around even those that have succumbed to COVID-19 may still infect others. More information on that as well will be available on our ENCA website, but still to come.